So this is how you get injured. When you have an unlevel pelvis, you have a subluxated ankle and other issues that are not corrected, biomechanical joint issues, that's how you get injuries. And if you want to avoid those running injuries, it's really good to check with a chiropractor. All right, so we got Phil here. Phil has been seeing me for on and off for, I don't know, what, a decade now?
Yeah, 10, 12 years.
10, 12 years, and he took on a new hobby, a fairly new hobby, right? The last few years running?
Yeah, last 5 or 6 years.
So that's something we both have in common. I'm a runner myself. I prefer triathlons, but he's a big runner, and he's had a couple injuries. So he was just in here the beginning of the summer with a groin hamstring injury and strain there, and we told him to lay off of it, and came back for a run. You said you felt a little bit of tightness in there?
A little bit.
After what, 6 weeks?
Yeah, well, the first run was like after 4 weeks, the next run was after 6 weeks.
Okay, because of the coronavirus and because he went away, we were unable to speed this process up. Normally we would use cold laser therapy, and this would get him through that injury in 2 to 3 weeks, half the time at least. So we didn't have that luxury because of coronavirus, so I told him to, when he goes on vacation, not to run, just to lay off of it. It is better, but now he has a new injury. Well, it's actually an old injury that resurfaced itself with a little bit of different pain. That's what it is. So I'm going to show you guys what I'm talking about here. And so why don't you tell them what kind of pain and discomfort you were having?
Yeah, so I started running again about a week and a half ago, and as far as the original injury, actually it feels really good at this point, but the my foot has pain. It feels like something's like out of alignment in the foot.
So he's been running with, we gave him orthotics years ago, but I guess they've been retired since. So he's been running with these orthotics. These are awful. I'm not even going to say the brand. It doesn't even have a brand name on it. The ones we carry and make here are really great, and they guarantee them. So you can wear them 6 to 8 weeks. We guarantee them. I'm not a big fan of those. I'm not surprised his foot's hurting and his ankle is subluxated. So we're going to show you how we check that and how we can, it's a really easy check, just a range of motion check, and you'll see. We've done this adjustment on you before, remember? So before you had a little bit of a different kind of pain. You had pain across here, across the top of your foot, right?
And on the outside of the foot, as opposed to the inside this time.
Okay, so he's always had more outside foot pain and across the front here, in the front of the ankle, on the top where the laces would go across there. That's really common for runners, and even if you've just like stepped off of a bus and kind of jumped down or something like that, and you know, or you're a trail runner, oftentimes I see ankle subluxations. Or if you've twisted your ankles a few times, all it takes is two ankle sprains or strains, and there is an inherent weakness in that ankle. That means the joints in the ankle are going to be more hypermobile and more susceptible to a subluxation. A subluxation meaning a misaligned bone, creating a lack of range of motion in that joint. So I'm going to show you here how we can tell right away with him. So when we dorsiflex his feet, you can see this right foot right over here is dorsiflexing more. This one is limited by at least an inch, maybe an inch and a half. We're going to zoom in and show you that. This leg, this foot dorsiflexes, toes up to his chin or to his head better than this one. This one's limited. Go ahead and watch this. You can see my left wrist is forward more than the wrist that I have this black wristband on. So he's limited in this foot. So we're going to go ahead and correct that. Man, just hold yourself onto that table there. Now we're going to check it again. and better, but not 100%. So we're going to do one more here. Just try to relax there. And I want you to hold there. Yep. There we go. I don't know if you guys heard that. And there we go. Now it's even. Now we shouldn't have any more problems. Okay, so we just adjusted his ankle and his pelvis is off, and I can tell that by just a leg check here, and then also I'm going to double check it here. And you notice here I'm flexing his legs here. And notice how this leg, this left leg goes, you know, close to the buttock. Not always. I'd prefer a little bit more flexibility there, but he's working on that. He's a runner. But this leg doesn't go as far right here on the right. I have to force it to go even. Now, do you feel that? More stress, more pressure on the right hip?
Absolutely.
Yeah, so the quad here clearly is tight, and it tells me this leg is also short by about a ½ inch, same leg. Tells me that his pelvis on this right side is pulled back and down. We're referring to the top of the pelvis here. So we're going to correct that because you don't want to run with an uneven and unlevel pelvis. This side up. And then after this, we're going to scan your feet. And now that I adjusted your ankle, okay, and then we'll scan your feet and see how flat-footed you are and see if you need orthotics, all right? Good. And the other side up. We're going to check his legs again after. So for all those runners and those running enthusiasts, relax here. Good, lay on your stomach. You think that if you go out and run with an unlevel pelvis and a subluxated ankle, you're going to be efficient with your running? No. And look at that, his ankles, his legs, feet are leveled or even. We're going to double check it here just so you guys can see. And look at that. Am I pushing harder on one side or evenly on both?
No, same on both.
Yep. And now they're even. This leg and this leg goes back evenly. I mean, if that's not telling, what is, okay? So this is how you get injured. When you have an unlevel pelvis, you have a subluxated ankle and other issues that are not corrected, biomechanical joint issues, that's how you get injuries. And if you want to avoid those running injuries, it's really good to check with a chiropractor and somebody that adjusts extremities like the ankles, shoulders, things like that. We're going to scan his feet in a minute here. We're going to finish up the adjustment and I'll show you what that looks like, the foot scan. So what I want you to do here is keep your legs straight, raise one leg as high as you can. Good, and the other one. Okay, how did that feel?
Fine.
Yep, both legs were going up evenly, so that's what we're looking for. We're checking for a rotated sacrum, and that's that test right there. You're really stiff through here. So we're just going to loosen that up and make that. Okay, turn over on your back. Slide down a little bit. Cross your arms in front of you.
Hey, not for the tape. Last time we did this, somehow like it really
Your shoulder.
hurt my shoulder.
Okay,
yeah,
so have you, let's have you lay on your stomach.
Okay.
Do that differently.
Okay.
And then I can take a look at your shoulder too. Okay, so have you, let's have you lay on your stomach. Do that differently. And then I can take a look at your shoulder too. And then I can take a look at your shoulder too. And then I can take a look at your shoulder too. Okay. And then I can take a look at your shoulder too. Okay. And then I can take a look at your shoulder too. Okay. And then I can take a look at your shoulder too. Okay. And then I can take a look at your shoulder too. Okay. And then I can take a look at your shoulder too. Okay. And then I can take a look at your shoulder too. Okay. And then I can take a look at your shoulder too. Okay. And then I can take a look at your shoulder too. Okay. And then I can take a look at your shoulder too. Okay. And then I can take a look at your shoulder too. Okay. And then I can take a look at your shoulder too. Okay. And then I can take a look at your shoulder too. Okay. And then I can take a look at your shoulder too. Okay. And then I can take a look at your shoulder too. Okay. And then I can take a look at your shoulder too. Okay. And then I can take a look at your shoulder too. Okay. Okay, go ahead, take a deep breath in and blow all the way out. Relax your shoulders and back. Okay, you okay there?
Uh-huh.
So that's a hard area to get adjusted right there in the diaphragm area. Sometimes people resist that. It's a tough area. It almost feels like you're getting the wind knocked out of you, right? But without the painful trauma of getting the wind knocked out of you. Good, doing up there, doing well up there. What's going on with your shoulder?
Yeah, I had a pain right where my thumb is.
Okay, right on the top there.
Uh-huh.
Okay, let's check your shoulder. Turn over on your back.
Point at it also well, so like right there.
Okay. Have you ever had bursitis?
Nothing I'm aware of.
Well, could be an indicator right there to have that pain a little bit lower down here, right off the edge.
Yeah.
Okay, that's an indicator of bursitis. But let's just go through some tests here. So arms out. I'm gonna push down. I want you to resist me. Ready?
Okay.
1, 2, 3. Resist. This one was weaker. Any pain?
Little.
A little bit of pain. Okay.
2 on a scale of 1 to 10.
Okay. And we're gonna head and do this. Palm out. Lock the elbow. So palm out. Palm out. Yep.
Okay.
Lock the elbow. Good. I'm gonna pull out this way. You resist me. I'm gonna pull this way. Resist me. Ready? 1, 2, 3. Resist. Any pain?
No.
1, 2, 3. Resist. Any pain?
No.
Okay. Other one. 1, 2, 3. Resist. Any pain?
No.
1, 2, 3. Resist. Any pain?
No.
Okay. And arms out. And 1, 2, 3. Resist. Yeah, this one's weak again. So. Okay. I'm going to show you something neat here. We're going to adjust your shoulder gently. You have an anterior humerus right here, so you're going to slide up that way, a couple inches. Keep going, keep going. Another inch or 2. There we go. Good. Arms out. Tell me if it's painful or you're going to resist me. Ready? 1, 2, 3, resist. What's stronger? Any pain?
No, feel good.
There you go. Anterior humerus subluxation is 90% of shoulder dislocations. Posterior is the other 10%, so it's always usually the anterior. Unfortunately, I've had a posterior and anterior throughout my life. I've rehabbed my shoulders many years ago. I haven't had issues with mine in 30 years. And all the stress that I put on my shoulders with adjusting people, I knew that in the beginning in my college career that once I had, dislocated my shoulder the 7th time, that I needed to rehab my shoulders if I was going to continue in this career. And luckily, knock on wood, I have not had issues at all in 20 years of practicing. But we're going to go ahead and check your neck and then scan your feet, okay?
All right.
Wiggle your toes for me. Good. Relax there for a second.
All right.
I'm going to set up the kiosk to scan your feet, okay? Yep, you'll just fill in a few questions there. It'll take you shift.
Okay.
And then it'll take you through a few questions. You can pick your 3 most common type of shoes you use. And then it's going to ask you to scan your feet. Make sure you're looking straight ahead, arms at your side when it scans your feet, okay?
All right.
So sneakers, definitely.
Right.
Casual shoes?
Yeah, casual
Dress?
shoes and dress shoes. Now,
Okay.
going back for a moment, again, I wear a different size in my sneaker than I do in my dress or casual shoes.
Great question.
So-
It's going to check and measure your foot, so you don't have to worry about that. And you can trim the orthotics down.
Okay.
So you're going to look straight ahead. We're just going to hit the scan button here. Look straight
Alright.
ahead, arms at your side. Okay, good scan. We're going to hit yes. Now it's going to take a look at your posture. So turn and face me. Look straight ahead. Good posture. And you're all set. That's your score. If you turn, you can see there. You're flat-footed. So those
Yes.
orthotics you were wearing were doing nothing to correct the arches in your feet. You have 3 arches in your feet. These are the proper feet right here. Those are your feet. You got a score of 143, which is a severe pronation score. You definitely need orthotics. And